Concur, it's been a pretty grim week for our health system, in particular our mental health system, those who work in it and those who rely on it for service. And I suppose one of the grimmest aspects of it is that we're here at 10 to 8 Thursday evening discussing this important issue, obviously the political agenda of the week being dominated by relatively minor electoral infractions by both sides of the House. On Sunday night, I learned that this a report was going to be in the media the following morning. First of all, I'd like to pay tribute to the author of that, the main author of that report, Dr. Susan Finnerty, and the Mental Health Commission for driving that report. I think it's fair to say they've done the state some service. In the report, we learned of poor monitoring of medication, children waiting days in emergency departments for psychiatric care, children left unreviewed on antipsychotic medication for years, deputies of the House saying that this is completely contrary to best practice. It shouldn't take ordinary people to know that. We're supposed to have a health service staffed by experts. Exhausted, overwhelmed and inadequately supervised staff, psychiatrists not trained to work with children, poor risk management, poor clinical governance and chaotic paper-based record keeping. The area that I represent, Clare, it's not identified in the report but it was identified in the Irish Times, is obviously part of the Midwest, the community health area, the CHO, which covers Clare, Limerick and North Tipperary, where it was found out that there were 140 open cases where it was identified that there was a serious risk to the safety and well-being of children accessing CAHMS, including the 140 with open cases who had been lost to follow-up. Now, the immediate response from the HSE was, as it typically is, one of defence and defending. There was a senior psychiatrist from the HSE on RT the next morning to say, well, but we had seen that ourselves. We had found that out ourselves before the Mental Health Commission came down, as if that was somehow a defence that they had seen it a year before the Mental Health Commission identified it and reported on it, but had done nothing, it seems, about it. Now, how that comes to pass is just beyond me. The part of the report that I found perhaps most depressing was the discussion of systems, because I've long held the view that we have no systems anywhere in our health care system. We have excellent people working, but we have no systems. It seems as a nation we don't do planning particularly well, and we certainly don't put systems in place. It might be something to do with a post-colonial legacy or something, I don't know, but we don't do it. The report identified one CHO in our review had a system that they had devised themselves, which allowed generations of reports, but did not provide electronic records. Only one CHO had electronic records. This system was provided through an independent agency which also provided the CAHMS service. And I think it's important to highlight that it was an independent agency. I don't highlight it with the view to suggesting that independent agencies should be providing all of the services within CAHMS, but if they can do it, surely to God the HSE can put a system in place. A small number of teams had independently tried to set up basic information systems within their own teams through their own knowledge of information technology to increase efficiency and monitor patient files and outcomes. But time spent in such matters takes away from time and patient care, and a national system would be the most efficient and effective way of dealing with this, the report found. It also went on to find that there were paper-based files were the norm rather than the exception. Those paper-based files were often incomplete. Lots of them there were handwritten notes in them which were illegible. I would like the Minister to come back if possible. I very much welcome that. And that meant that people couldn't travel out to provide a service. They had to be provided within it. But if that wasn't depressing enough, on Wednesday we woke up to learn that Martin Curley, Professor Martin Curley, who was the person tasked with delivering the digitisation of health services across the entire HSE, that he had resigned from his position, saying that there were bad actors within the HSE blocking the implementation of this. He helpfully pointed out that Ireland had been loaned €200 million from the European Investment Bank. Here we are, one of the biggest budget surpluses in Europe, and we're loaned money from the European Investment Bank. And even then, we can't put information systems in place. Now, who is blocking this? Because I'm sick of the defence. I'm sick of the HSE defending. Over the Christmas, the department were defending that it was the HSE's fault. The HSE were saying it was the department's. Frankly, I don't much care. I mean, I know that the Secretary-General of the Department of Health was appointed to the board of the FAI during the week, and if he can bring his defensive capabilities from our health system to the FAI, well, we'll have maybe a team with a defence like Italy, but they return to a functional health system. We in Ireland have an utterly dysfunctional health system. Deputy Collins pointed out how little we spend on mental health. It's quite true. It's utterly inadequate. But we spend a lot of money on health in this state, as much as Austria and Denmark per capita, but we don't get a return. And that complete lack of systems is part of that. Now, if you were the Minister, you've worked...
Deputy, and you're testing my
I would just nature. I think it's important that the Minister identifies who is blocking this, and that they are removed, that the blockage is removed, and systems are put in place such that 140 vulnerable constituents of mine will never again be lost in a system that they rely on for help, for protection, and for a decent healthcare system, Ceann Comhairle. And I think it's an abomination that we're discussing this at 8 o'clock on a Thursday evening. You don't set the agenda, I appreciate that, but it speaks volumes about the priorities of our political system.
Well, I'm just thinking, listening to you and to the previous contributors, that I find myself regretting the fact that custom and practice ordains that I cannot, or anyone who operates from this chair, cannot take full part in debates, but I will make this contribution. This has been an exceptionally important debate, and whether it happens on a Thursday evening or any other time doesn't take from the importance of it, and the contributions that have been made have all been valuable, and the issues that are being touched on impact us all, every one of us and every one of our families. And there's one commonality in all of this, and it's our common commitment to ensuring that we build the best possible service that we can, that our children and our adolescents deserve. But one word of caution to all of you that I'd utter, and that's that as public representatives, we need to be conscious that this is a particularly sensitive area, and it behoves us to build some degree of hope and instill some confidence in the people who need the services, that they're not going to be abandoned, they're not going to be left without care, and that we are, all of us, every one of us here, committed to looking after them. Now, Minister, sorry.
But do we do that by ignoring the report that's completely damning?
Well, no, I don't want to ignore anything, and I'm sure the Ministers will address that in their response.